You're listening to Health Professional Radio with Wayne Buckler. Today my guest is Murray McDonald. Murray's a director with Duplex Cleaning Machines Proprietary Limited. Welcome to Health Professional Radio, Murray.
Thank you very much, Wayne.
Now, Murray, tell us to start with a little bit about Duplex Cleaning Machines and what product it is and what geographic footprint you work in.
Well, we provide chemical-free cleaning solutions to the healthcare industry. We focus on high-temperature steam technology. So that technology has been around for many years. So for 25 years, we've worked in sustainable healthcare cleaning, disinfecting solutions. In recent times, some of our activities have been from providing auditing systems for cleaning to advice and information how to get better cleaning methods and better cleaning systems into healthcare environments. With things like a product that we have is a healthcare cleaning auditing application called Audit Scan. So those operations go between Australia, New Zealand, and into Asia Pacific, the Southeast Asia market.
Okay, so you've got a much wider service footprint than I imagined. I was thinking it was only Melbourne, but it's in fact Australia-wide and Asia Pacific.
Yeah, so we're in every capital city. We have operations. So we have a local people or local staff in every capital city. But we do a lot of work out into country, regional areas around Australia and New Zealand. So that's probably Australia is one of our major markets. We've got our distributors in Southeast Asia and Singapore and Malaysia and Hong Kong and China and Japan. And so we travel widely around the area.
Okay, now just paint a picture for me of what this process looks like. How does this high temperature steam cleaning work in practice?
Well, the practice is very simple. I suppose really we go across and carry out cleaning and disinfecting on high touch surfaces because science has shown that the places where people are touching, whether it's staff, patients, they're the two critical ones, but also visitors coming in, that's where the contaminations are occurring or the bed of bugs. So whether it's a light switch or a doorknob or a tray table or some drawers, they're critical surfaces rather than the actual floor surface. So our high temperature steam just sprays out lightly over these surfaces and with a very simple little lance, and the person has a microfiber, normally a microfiber glove onto it or cloth, and they can go across the heat, disinfects the surface, a little bit of moisture is washing and cleaning the surface at the same time, and beautifully removing any contaminants that are on that surface without needing to use any other chemicals. So it's a very quick, logical process that gets carried out. Right?
I see. Now, Murray, most of our audience work in acute care facilities, are clinicians in hospitals. What is it that you'd like them to know about your product?
Well, everyone is, I suppose, used to using a chemical in carrying out. So if a carer or a clinician who's gone through, a patient might have changed over, and everyone is so used to using chemicals and a very manual process for cleaning. Mm-hmm. So really, these days, the world has moved on. We don't necessarily need to use that all the time. We're using 3,000-year-old mop and buckets in an operating theatre these days. I'm sure there are better practices than using that these days, Wayne. So, changing the way that we look at things and changing the way that we do that, and certainly the steam technology and microfiber can really move away from the chemicals, the old outdated cleaning tools like the mop and bucket, recycling contaminated water, and now push into a cleaner, more disinfected and sterilised way.
Now, of course, in the health industry, 3,000 years is not a long time. This is not an industry renowned for adopting things really quickly. I understand you've written a book, 5 Steps to Chemical-Free Cleaning in Healthcare, to try and drive home this point. Tell us about the publication.
Yes, the book, we wrote that last year, and we printed that, so that's available. It's really a step-by-step guide, and it's the 5 steps to chemical-free cleaning. It's a step-by-step guide to best practice, looking at research over the last decade, because previously there hasn't been a lot of research carried out on cleaning. Yet with all the superbugs that are now increasingly occurring and outbreaks, a lot of research has been invested throughout the world over the last decade or so into this cleaning and infection control. So that knowledge really sits often within the infection control group and doesn't really get passed down to the cleaning staff or clinicians that are out onto the ward area. So we thought we'd write a book and put that content into print and start to educate people. So we go through a process of best practice, looking at identification and pre-planning how they're going to introduce a better cleaning system. We look at assessment, auditing. How can you audit your current cleaning system? How do you know where to start on what is working and what is failing within your current cleaning, disinfecting process? And then we go into the planning, developing goals, managing objections from staff. This is change. We're dealing with humans, habits, and how do we move people from one system to a better system. And then we go into formalising a program, so it makes it easy. And then the implementation, getting into touch point cleaning, and then training and consistent workflows. So people are doing a better, more logical job and not missing key touch points in a healthcare facility. And then we go into the evaluation, how to then audit against their earlier assessments. So benchmarking, getting into the benchmarking. Yep. So that's what the book goes into. So best practice, Wayne.
It is one of those fundamental things in healthcare, isn't it? And infection control. It's one of the areas that it's nice to see some research being applied to and some solutions with your Duplex cleaning machines being able to actually make that an easier process than it might otherwise be. You're listening to Health Professional Radio with Wayne Buckler. My guest today is Murray McDonald, the Director of Duplex Cleaning Machines. Murray, one of my favourite questions to ask people is about misconceptions. If there's a misconception about chemical-free cleaning that drives you nuts and keeps you awake at night, what would that be?
There's probably a couple of things there. People think it will cost more. People don't like to change in their current process, or they're very happy. We mentioned before about habits and how big a step it is to change. And always people think there's going to be a cost related to it. But these days, costs of things, and they look at the labour, or people may not look at labour content that gets time it takes to do a task now with their existing systems, and then move into a chemical-free cleaning system. There's a lot of studies and research work that has gone into that component, independent studies that verifies that you can get better outcomes, less outbreaks, less chemical usage, and using less chemicals. So there's actually dollar savings just in those alone. Then so it becomes cost neutral, very much so, the process. But there's many savings that can be gained from water savings, and these days we don't look at the environmental impact of some of the processes that we are doing. So there's also savings on the environmental side of things.
Murray, I think it's a fascinating topic that you brought up. How can people get in touch with you?
Very simple. They can go on to our website, Duplex Cleaning They contact there with us. They can telephone us and talk and communicate on 1-800-622-770.
Now, every time I do one of these interviews, Murray, and I give a phone number, I always get complaints that people didn't have a pen in hand. So, fair warning, get your pens ready. Give us that number again, Murray.
It's 1-800-622-770.
Murray, it's been a pleasure having you on Health Professional Radio this morning. We'll do a transcript of this interview for anyone who's missed it and a SoundCloud archive. They'll be available on our website at www.hpr.fm. My name's Wayne Buckler. You've been listening to Health Professional Radio.